male catheterization. Today we will start with a procedure that is male catheterization. In general, the basic steps, there will be an actor and there will be a module. Beside the module, there will be an actor. The examiner will help, and sometimes examiner will tell this is sterile area and this is non-sterile area. If they don't mention, then we have to clarify them. This is my sterile area and this is non-sterile area. So first of all, introduce and patient identification, then consent, and then WHO checklist and patient's file review, then equipment collection, then the positioning and the procedure. This is overall. And then there will be presentation and a short presentation, or it might not require, directly examiner will ask question. This word file, male catheterization. Okay. There is an actor beside the module. The examiner will help you. You should mention from the beginning your sterile and non-sterile areas, or the examiner may tell you this is your sterile area and the other area non-sterile. So start to prepare your equipments. You should mention the indication and the complications for the procedure. Introduce. Hello, I'm Dr. I would like to edit my name. Hello, I'm Dr.Adhikary, one of surgical doctor. Could I confirm your name and age, please? This is two part. One is introduction and confirm patient's identity. Then explain the procedure. Today I have been asked to insert an elastic tube in your external genitalia to allow you to pass urine, or for monitoring the urine output. This will be under sterile condition and using some numbing agent, so typically you will not feel any pain. It may carry some complications like bleeding. So in this part, basically I am explaining the procedure as well as why I am going to do this. I mean, indication of the procedure, risk of the procedure, and the complication of the procedure. Again, today I have been asked to insert an elastic tube in your external genitalia to allow you to pass urine or to monitor the urine output, depending on the scenario, because sometimes in the scenario it may say patient is not passing urine since last 4 hours, or need to monitor his urine output. So according to indication, we will explain. Then this will be done under sterile condition and using numbing agent, so you will not feel any pain. It may carry some complications like bleeding, infection, and false passage. It may include some risk, that is bleeding. It may carry some complications like bleeding, infection, and false passage. Then are you okay with that? Are you okay with that? Then the candidate, I mean the actor will give the consent. Yes, I'm okay. Now the safety. Do you have any previous catheterization? Do you have any previous catheterization or any previous pelvic surgery? The actor or the examiner will say no or yes, whatever. So this is one part. Then safety. Do you have any previous catheterization or any previous pelvic surgery? I want to check WHO checklist. I want to check WHO checklist to confirm patient's ID on the bracelet and the procedure and side of the procedure. Again, I want to confirm WHO checklist. When I will say this one to the examiner, towards the examiner, facing towards the examiner, then examiner will say, consider it as done. So again, I want WHO checklist to confirm patient's ID on the bracelet and side of the procedure to detect if the patient takes, to detect if the patient take any regular drugs, especially any blood thinners. To detect if the patient take any regular drugs, if the patient takes any regular drug, if the patient take any regular drug, if the patient take any regular drug like any blood thinners. To detect if the patient take any regular drugs, especially blood thinners, if he has allergy to any medication, especially iodine, latex or local anesthesia, because to make the procedure sterile, initially we will give iodine sterile wash, then the catheter we use, that is a latex, and also the numbing agent xylocaine. So for these three we need to take their allergic history. So do you have any allergy, especially any latex, local anesthesia or iodine? Then patient will say no. A second examiner may act as an assistant and offer to get a trolley ready for you, or the nurses will be there. Okay, now I will take, as it is catheterization, so first of all we need catheter, and the size will be 14 FR. So urinary catheter size 14, expire date on the catheter packet, so it is just like acting, or sometimes it may be given and everything kept over the trolley according to sterile and non-sterile area. But whenever we start, we need to tell I need sterile catheter, urinary catheter size 14. Then we take the catheter in our hand and we say expire date 26th February 2016, 26 or whatever. Then anesthetic gel, sometimes it is pre-filled syringe, or maybe in some bottle. In stellar gel, anesthetic or antiseptic lubricant, minimum 10 ml and read expire date. So first urinary catheter, as it will be under a numbing agent, so we need anesthetic gel and minimum 10 ml. Also we have to mention the expire date. Then catheter bag, 2 pair of sterile catheter bag, 2 pair of sterile gloves, forceps, kidney dish, gallipot, sterile gauze, sterile draper, skin preparation solution, 10 ml syringe, in 10 ml syringe with 10 ml water, not saline. Basic catheter pack contains most of the things, and okay, you have to divide into 2 separate area besides the patient and tell the examiner about them. So this is my sterile area. Sterile area will contain syringe, sterile gloves, gauze, syringe, sterile gloves, gauze, and non-sterile area, catheter bag, etc. Positioning, plastic module, patient should be as flat as possible to perform the procedure. Then procedure, hand wash, wash your hand, prepare the equipments, open catheter, Instagel, instiller gel, that is the numbing or anesthetic agent, and gloves sterile filled with a non-touch technique. Pour saline into sterile pot, place catheter drainage bag at the end of the bag, obtain adequate exposure, clean your hands with an alcohol-based agent and first pair of gloves. If said in the steam, do not change the gloves, then do not do it. Use one hand to retract the foreskin using a gauze as a sling and clean the foreskin, glands and the meatus, sweeping away from the urethral meatus. Separate swab for each using forceps if available. Change to second pair of sterile gloves. Okay. Drap the patient. Sometimes it is already draped. Insert instiller gel into the urethra and wait for 3 to 5 minutes. Have inform patient. Here, inform patient, I will put gel inside your penis. That will be irritating at the beginning. Then I will wait for 5 minutes for local anesthesia to act. Then the examiner will say, okay, 5 minutes over. Place the kidney dish or collecting dish between the patient's leg. Remove packing on the tip of the catheter and advance the catheter with the penis held pointing to the ceiling with gentle traction. Pass the catheter all the way to the hilt and wait for urine to drain. Try to roll only by rolling in module. Okay. After urine has started to drain, inflate the balloon with the appropriate amount of sterile water, usually 10 ml, but some such as three-way catheter require 30 ml, and withdraw the catheter gently. Replace the foreskin if present, dry and cover the patient before asking them to redress. Dry and cover the patient before asking them to redress. You may dress now. Do you need any help? Dispose the equipment in the appropriate bin. I will measure the amount of the urine draining after an adequate period of time, 5 to 10 minutes. I will measure the amount of urine. I will measure the amount of urine draining after an adequate period of time. I will measure the amount of urine. I will measure the amount of urine draining after an adequate period of time. I will measure the amount of urine draining after an adequate period of time, that is 5 to 10 minutes, and I will obtain a catheter urine sample for culture and sensitivity, for microscopy, culture and sensitivity. Okay. I will measure the amount of the urine. I will measure the amount of the urine draining after an adequate period of time, at least 5 to 10 minutes. I will obtain a catheter urine sample for microscopy, culture and sensitivity, and document the procedure in the notes and write request for culture and sensitivity. Take list for male catheterization. Okay, this thing actually no need. Okay, now these are the questions from the examiner. What is catheter? Catheter is a surgical apparatus. It is a sterile hollow tube that is inserted into the body. They are not asking about the urinary catheter, any catheter. So catheter is a surgical apparatus. It is a sterile hollow tube that is inserted into the body and uses during urinary draining, like urinary catheter, infusion of drugs and fluids, and monitoring central venous pressure. So during drainage, urinary catheter, infusion of drug and fluid, and monitoring central venous pressure. During your procedure, after inflating the balloon, the examiner will ask you, if no urine is coming, what is the commonest cause of anorexia? Yes, exactly. Blocked catheter due to gel. Blocked catheter due to gel. Blocked catheter due to gel. During the procedure, after inflating the balloon, the examiner will ask, if no urine is coming, what is the commonest cause of anorexia? Blocked catheter due to gel. Blocked catheter due to gel. Commonest cause of blockage. Commonest cause of blockage. Blocked catheter due to gel. Commonest cause of blockage is gel. What would you do if no urine drains after catheterization? First, pressing the suprapubic region, and re-evaluate presence of urine in the presence of percussion over the suprapubic region. We will percuss to check either the bladder contain any urine or not. Re-evaluate presence of urine in the bladder. Apply suprapubic bladder massage. Aspirate with a syringe. If no urine coming, then we can do flash with 50 ml of water and will aspirate. If no urine, then we will do flash with 50 ml of water, and again we will aspirate, and we will try to check the amount of aspirate. Nothing should be introduced until I see the urine. If you do all these measures but still no urine, then I will check the fluid chart, because if there is hypovolemia, I will give fluid challenge, that is 500 ml over 15 minutes. And if no hypovolemia, I will check the fluid chart. If there is hypovolemia, I will give fluid challenge. If hypovolemia, I will give fluid challenge, that is 500 ml in over 15 minutes. If no hypovolemia, take out the inserted catheter. Why you will take out the catheter? Because it may be in a false passage, and catheter tip in urethral, not in the bladder. Not a true palpable bladder. Suprapubic muscle. Okay. Because it may be in the false passage, catheter tip in urethra, false passage, catheter tip in the urethra, not in the bladder, and not a true palpable bladder. And if not a true palpable bladder, then we can give suprapubic massage. Which part of the catheter will use to do flashing? The part connecting with the urine bag. The part which is connecting with the urine bag. What amount of fluid should be used for flushing? 50 ml. Which is your differential diagnosis for suprapubic mass? Suprapubic mass malignancy from bladder, prostate or colon, 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 okay. What is the differential diagnosis of suprapubic mass? Suprapubic mass, it could be malignancy from the bladder, prostate or colon. Bladder, prostate or colon, pelvic collection, pelvic abscess, large iliac aneurysm, malignancy from bladder, prostate or colon, pelvic collection or abscess, large iliac aneurysm, we do all previous measures and we ensured that the patient is euvolemic. However, he still has anuria with normal ultrasound. Why? We do all previous measures and we ensure that the patient is euvolemic. However, he still has anuria with normal ultrasound. Why? He has acute renal failure. Now, causes of acute renal failure causes. Acute renal failure, pre-renal dehydration, burn, sepsis. Pre-renal dehydration, burn and sepsis. Pre-renal dehydration, burn, sepsis. Dehydration, burn, sepsis. Renal, that is renal, some drugs, NSAIDs, AC inhibitor, aminoglycosides, NSAIDs, especially diclofenac, AC inhibitor, aminoglycoside, and post-renal ureter obstruction and lower urinary tract obstruction. Ureter obstruction and lower urinary tract obstruction. Post-renal ureter obstruction and lower urinary tract obstruction. What will be helpful for you from history of this patient to reach the diagnosis? Okay, any history of hypertension, because patient might taking any AC inhibitor or any diabetes mellitus. Patient will be immunocompromised, so there is chance of sepsis, and medications, suppose NSAIDs, nephrotoxic, antibiotic like aminoglycosides. So from the history, any presence of hypertension, diabetes, medications, NSAIDs, nephrotoxic, antibiotic like aminoglycosides, etc. Not in the checklist. If unable to pass catheter, use adequate local anesthetic gel. Consider different size catheter. If unable to pass catheter, use adequate lubricant and reconsider the size of the catheter. Large size may be easier to insert in BPH. Consider co-tip catheter to ultrasound scan. Call urology. Other causes of anuria. Urethral stricture, benign prostatic hyperplasia, benign prostatic hyperplasia, bladder stone, acute renal failure, and hypovolemia. Again, other causes of anuria, if patient is not hypovolemic. First cause of anuria will be hypovolemic. If patient is euvolemic, then what could be the other cause of anuria? First, urethral stricture, benign prostatic hyperplasia, any bladder stone obstructing the urethral orifice. So, urethral stricture, benign prostatic hyperplasia, bladder stone, acute renal failure, hypovolemia. Complications of catheterization, allergic reaction from latex, iodine, or anesthetic gel, infection, maybe urinary tract infection, urethritis, prostatitis, and urethral injury. Complications of catheterization, allergic reaction, infection like UTI, urethritis, prostatitis, and urethral injury. So this is all about questions. One second, I'd like to go here. Okay. What is catheter? Okay. If unable to pass catheter, what you will do? Consider adequate local anesthetic and gel. Consider different size catheter. Large size may be considered to insert in BPH. More stiff and easy to pass, and consider cold tip catheter. Do ultrasound scan and call urology. Commonest cause of anuria, blocked catheter. Commonest causes of anuria, blocked catheter due to gel. Other causes urethral stricture, benign prostatic hyperplasia, bladder outlet obstruction or bladder neck obstruction or bladder stone, bladder outlet obstruction or bladder neck obstruction or bladder stone, acute renal failure, hypovolemia. Commonest cause of block is gel. What would you do if no urine drain after catheterization? De-evaluate presence of urine in the bladder by percussing the suprapubic region. If you have not done this already, apply suprapubic massage, aspirate urine. If no urine, I will do flushing and aspiration. Nothing should be introduced until I see urine. If still no urine, first I will take fluid chart. Consider flushing by 50 ml of water. Okay. If still no urine, first I will check fluid chart. Consider hypovolemia. Give fluid challenge, that is 500 ml in 15 minutes. If no hypovolemia from the fluid chart, take out the catheter. Okay, why? Because it may be in the false passage, catheter tip in urethra but not in the bladder, not a true palpable bladder and suprapubic mass. You insert the catheter, it drains no urine, and you therefore remove it. You then examine the patient's abdomen and there is a suprapubic mass. What is the differential diagnosis? It could be bladder mass, not bladder was not catheterized appropriately. It could be malignancy. From the bladder, prostate, or colon, and pelvic collection or abscess, and mesenteric cyst, large iliac aneurysm. If it's still anuria with normal ultrasound and normal fluid chart, it could be due to acute renal failure. It could be due to acute renal failure. Pre-renal, decreased renal perfusion due to dehydration, burn, sepsis, and hemorrhage. Pre-renal dehydration, burn, sepsis, hemorrhage. Renal nephrotoxic drug like NSAIDs, diclofenac, ACE inhibitor, acute cortical necrosis. ACE inhibitor causes acute cortical necrosis and aminoglycosides. Acute cortical necrosis and aminoglycoside. Also contrast acute renal cause NSAIDs, especially diclofenac. ACE inhibitor, it causes cortical necrosis, acute cortical necrosis, aminoglycosides. And contrast. Post renal ureteric and lower urinary tract obstruction. Examiner asked what will be helpful for you from the history. Hypertension, diabetes, patient take any NSAIDs, nephrotoxic antibiotic like aminoglycoside. Complication of the catheterization, allergic reaction, infection, urinary tract infection, prostatitis, urethritis, and urethral injury. Okay, so this is all about male catheterization, and I'd like to go through video.
Okay, for the male catheterization station, what you're going to have as a STEM is in your hospital, a 50 years old male came and the patient is having acute retention of urine, and you are a surgical SHO, you are attending the patient. Now the patient is requiring a Foley's catheterization, all right? So here, what we're going to start, what we're going to do, again, we have to follow the 10 steps approach for the procedural skills, okay? So we are going to introduce ourselves, and then we are going to confirm the patient name and age. Then we are going to explain what we're going to do. Okay. So for this purpose, we are going to explain. Okay. Today we are going to introduce a rubber tube through your private part or the genitalia. Okay. Don't worry. We are going to use some numbing agent. You will not feel pain. All right. Is that all right for you? You're gaining the consent, and also you are going to ask for the WHO surgical safety checklist. You are going to check the ID on the patient's bracelet, and you're going to check about the procedure, whether it is correct or not. You're going to ask for the medication, especially the blood thinners, and also you're going to ask for the allergic history from the patient. Are you allergic to any kind of medications or the numbing agent or the iodine? After that, you have to arrange your equipments. Okay, what are the equipments you need for? First of all, in this station, you are going to have a basic catheter pack, okay, and that the basic catheter pack will be given by the assistant, okay, and you will have some kidney dish, gallipot, gauze, sterile drape will be there, skin preparation solution. You're going to have 2 pairs of gloves in this station particularly, and you have to change your gloves in between your procedure itself, okay. I will mention when you have to change that. Also, you are going to have an appropriate urinary catheter, and then you are going to have you need a 10 ml of syringe and also some distilled water as well, okay, and you are going to have a Euro bag along with that, okay. At this point, you have to see whether the patient is properly positioned or not, okay. So now what we have to do is, first of all, we are going to wash our hand and we are going to wear gloves, okay. Now at this point, what we are going to start with, in your exam, if you see the patient is having a prepuce, okay, then what you need to do, you need to retract the prepuce, okay. That's the first one you have to do. You need to retract the prepuce. All right. After that, what we have to do is we are going to give it a wash, okay. How can we give it a wash? Simply, we have to take maybe 3 or 4 gauze piece, and we are going to start with the glands. And always remember, you cannot use this once you have touched the genital area once, okay. So which means you are going to take only one wipe, and then you have to discard this into the general waste, okay. Take another one, okay. Again, you just simply give it a wash and then you remove, okay, or you throw it, and you are again giving it a wash.
This is
and
with
then
iodine or normal saline?
whatever is available in your exam, you have to do that with that. All right. Maybe they are going to give you an iodine, and sometimes they will say, okay, consider the normal saline is appropriate for your skin prep. All right. After that, 3 to 4, or if you want, if there is, you see there are lots of gauze piece are there, then you can go for the 5 strokes, and that will be enough. All right. After this, after you clean the penile area, after that, what you have to do is you have to clean the outer areas as well. And always remember, you are going to clean the from center to periphery. Okay. Once you are done with the center, you cannot go back. All right. So after you clean the overall peripheral area, then what you have to do, you have to put a drape, a sterile drape around the penis. All right. Like this, you are going to put a drape simply just around I have made a big cut, sorry about that. But you're just going to put a drape around the penis like this, okay? All right. After this, what we need to do, simply we are going to hold the penis, okay, with the help of a gauze, and we are going to hold just like this, okay? And we have to put what? Who can tell me what we are going to put?
Insular gel.
Correct. So we are going
Anesthetic jelly.
Right. So we are going to introduce the instilla gel, or as we know, this is the Jesuken jelly we can introduce. So you put as much as you can, okay? And there will be a cap in front of it. Like I wasn't able to find that cap, sorry about that. So you have to use that cap, and you insert that cap within the glands, and you are going to put a lots of gel inside of the penis. All right. After this, you have to tell, I'm going to wait for 3 to 5 minutes so that the insular gel can work. Okay. And at this point, with the back of your...
Sir, should we give the whole tube of Jesuken jelly?
Actually, whole tube is not necessary. You can give it half, okay? Or in case if they give you the insular gel, you know, insular gel have a appropriate amount, the exact amount you need to give, okay? So in case of the insular gel, you have to give it a entire amount, okay? But if they give you the tube like this, then you can give a half of it, no problem. After that, you can give it a like simple massage below the glands, just like that, so that the numbing agent starts to work and it goes deep. All right. After that, what you have to do is you are waiting for 3 to 5 minutes, and at this point you have to wash your, like you have to change your gloves for the second pair. At this point, you are going to use the second pair of gloves. Okay. So suppose the 3 minutes is over. At this point,
we have to put our gloves, both gloves at the beginning, and just remove the...
No. Okay. You have to put don't make them like, you know, don't show them tricks this, okay? So you have to put them separately. All right?
Yes, sir.
You remove one gloves and then you put the another one. All right? After this, you are going to put a kidney tray on the patient's leg, in between the patient's leg here, and then you are going to ask for the catheter. And always remember, for the insular gel, for the catheter, you are going to ask for what?
Expiry date.
Expiry date of the catheter and everything you are going to use. Okay. Now at this point, we have to hold the patient penis like this. Okay. And then we are going to introduce our catheter simply just like this, a little bit. Okay. Not more. Just a little by little, you will feel some resistance as well. Okay. So you have to insert this a little by little, and then after you inserted this, you see maybe there is a urine is coming out, or maybe there is the water is coming out from the tip of your catheter. Okay, from here the urine is coming out or the water is coming out. Okay, at this point, if the patient asks you, there is a new question, I'm just saying this, while you are inserting the catheter, the patient might be saying, okay, I'm very dehydrated. Can you just give me please some water, please? What you can tell to the patient then? what you will say? Can anyone tell me what you are going to say to the patient?
I'll say that just wait for a few minutes after you can have water.
That's the fault everyone will do. Don't do that. Okay.
Ask the examiner that can
IV
the
fluid.
patient be given the water.
So the thing is, our patients are our, like, they are our all priorities, right? If they say, I'm dehydrated, please give me some water. You just instantly look at the examiner or the assistant and tell them, we need some water. Can you just arrange a water for the patient? The patient needs to drink some water. And the examiner will say, consider it done. Okay, this is a tricky question. And most of the candidates who has went for the exam, they say, okay, you can wait till we are done with our procedure. After that, you can drink. This is not the correct way of mentioning things. All right, this is not a professional thing. So you have to mention, okay, yes, you can just wait for a second. Can you please, you are saying this to the assistant or the examiner, can you please arrange some water for the patient? The patient needs to drink, all right? And then the examiner will mention, okay, consider it done. Okay, so now we are seeing there is some urine is coming out. So what we need to do is simply, we are going to pull the catheter a bit to see whether there is a resistance or not. At this point, or what? We have to
After inflation.
Correct. Correct. So at this point, what we have to do, we have to inflate the balloon, right? And then we are going to pull the catheter so that we will see there is some resistance. And at this point, what we have to do, we have to connect the urobag here, right? Just like simply this, we are going to connect the urobag, okay? And then we will leave, and also we are going to wash the general area, and we are going to remove all the things, okay? And we have to dispose everything into the general waste, okay? At this point, what we need to do, remember, we have retracted the pupils, right? We have to reposition the patient's prepuce again. Remember that. Then we have to cover the patient and we have to thank the patient, okay? And was there any sharps that we have used in this case?
No.
No. Okay. At this point, we are going to give some advice to the patient, okay? There will be no pain, okay? Because we already given some numbing agent for you. But if you see there is a pain, if there is a pain is increasing, or your tummy is getting distended, okay? If you feel feverish, or if you see the blood is coming out, please contact the nurse immediately. Why the patient will be asking for the nurse? Because the patient is already into the hospital, and in most of the cases, the patient is hospitalized, okay? Next point, you are going to thank the patient, and then you are going to wash your hand, okay? And you are going to mention, now I am going to document my procedure, and also I want to take a sample of the urine after 5 to 10 minutes, and also I want to write a request for microscopic culture and sensitivity. Okay, everyone?
Yes, sir.
Yes.
Perfect.
Yes,
so this is very, very easy station to go through. Just you need to know what is the exact steps that you have to go through in which directions. All right, very, very easy station to perform. All right, so they are going to ask you. Yes.
During the retraction of the foreskin, we use a.
This is a maquette you're going to have, just simply just like this. Okay, you're going to have a maquette, not in a real patient. Don't worry about that.
Okay.
Sir, during the wash, you said we will use every gauge single time.
Throw it, all right?
Some specific place or?
This one?
Yes.
You can put it on the table.
Okay.
To the gallipot with like this, and just give it a wash and throw.
Okay. And another question is, after the end of the procedure, do you have to fix the catheter to the thigh or something like that?
No, the assistant. Okay.
Sir, during all the procedures, like the assistant is going to help us. Is there anything like we shouldn't say to the in
You
general?
can add please. You can add please, and
Yes.
it
So
is like
whenever,
your tone should be in that way.
right. So the
That
thing
you are
is,
requesting.
whenever you are asking anything, you cannot give them orders. Okay. So you have to request, can you please bring me the general waste, please? Can you bring me the Euro bag? Can you connect it, please? So you have to be like, very polite and
Very
professional
polite.
as well. You cannot like order them, bring me the general waste, okay? Give me this, give me that. No, you cannot do that. Right, in normal, yes.
Sir, is there any specific technique to open the internal packing? Because police is
Forceps,
Or maybe right? Or maybe there is a body, maybe you history or not. Also, you can then, and it is draining no water, no urine is there. So you remove the catheter, okay? And you are